Welcome back. One of the areas hardest hit by Elon Musk's DOGE effort is the Department of Health and Human Services, which operates everything from the Centers for Disease Control, the Food and Drug Administration, and the National Institutes of Health. At least 20,000 people have been fired, and hundreds of millions of dollars in grants and research, including tens of millions of dollars slated for Florida universities, are being eliminated. Now, before she was a member of Congress or the president of the University of Miami, Donna Shalala served 8 years as the HHS secretary under Bill Clinton. I asked her this week for her reaction to what is happening at HHS.
You know, these cuts are reckless. They're not targeted. There are ways to reduce the size of government. We did that during the Clinton administration without laying people off, with minimal reorganization, because we were focused on saving lives. The problem with these cuts is they put America's health at risk. They put our economy at risk. There's nothing that drives the economy more than the NIH investments. It's not just the personnel at NIH. It's the investments in the future, the discovery of new drugs, the discovery of cures, and to recklessly cut across the board NIH is just a disaster for this country and for our future.
I think we're looking at close to 20,000 people being fired or laid off from HHS, including 6,000 new employees that were coming on, theoretically to replace retiring employees, probationary employees. And when you do that sort of wholesale cutting, as you sort of said, you end up hurting significant departments within the agency that are no longer able to completely do their work. Are there any particular areas that you've seen that's been noted that from your experience that draws real concern for you?
Well, first, the NIH cuts, which I believe are a disaster. But then you look at the CDC, the group that goes after some of these measles. And by the way, we're having a measles epidemic in this country. And what's going to be next? Polio? By people that are not getting their vaccines for their kids. And so the fact that we have not been able to contain the measles epidemic, it may well lead to other diseases. These outbreaks are very dangerous for people in our country. They're dangerous for those who are too young to be vaccinated, as well as, more significantly, those that have not been vaccinated. And the new secretary of HHS has sent mixed messages about vaccinations.
Well, let's stay with that for a second. I was going to go to another area, but let me ask you about the appointment of Robert F. Kennedy Jr. to be the HHS secretary.
I think he was anti-science, anti-government, and had absolutely no experience managing a large, complex institution. If you look at all the previous Republican that have headed HHS, look at Mike Leavitt, who was a governor, at Tommy Thompson, who was a governor, at Alex Azar, who had ran a major pharmaceutical and had been deputy secretary at HHS under Bush. These Republicans had had extensive management experience, were pro-science, were pro-vaccines, but also served the American people in a different way than the Democrats did. They did not believe in larger government, but they did believe in science. And they're in investments, for example, Alex Azar in Operation Warp Speed saved millions of lives. We now have a secretary who is actually putting at risk millions of lives.
He claims that his focus is now more on making America healthy again by focusing on a healthier lifestyle for Americans. That may be admirable, but your reaction to what he's trying to do?
There's nothing wrong with those as goals, but in the process, you don't eliminate the underlying science and the underlying programs. For example, the AIDS programs. Miami is number 2 in the new incidence of AIDS and HIV. We need those programs for prevention, but also for discovery. We still have a lot of work to do on AIDS. He allowed the president and encouraged the president to eliminate the relationship with WHO. Diseases don't know what boundaries are. We need the WHO to help prevent disease around the world that may eventually end up here in the United States. Most recently, NIOSH, the National Institute for Occupational Safety, they're going to eliminate that agency. That's the agency that reviews and does research on occupational safety. We don't need, as the supposed expansion of manufacturing goes on, we don't need more people getting accidents. And that has been a traditional role of the federal government. And now they're talking about Head Start. Who eliminates Head Start? Millions of kids have had that child care program. We introduced healthcare into it. It's an extraordinary program that's made a difference for low-income kids. So what they're doing is reckless, and it's not going after waste, fraud, and abuse. As far as I can tell, Jim, all they're doing is abusing federal workers. The waste and fraud has not been eliminated. You need an IG who they've fired. You need the FBI unit, and you need the Department of Justice to focus on waste and fraud.
Michael Lewis, the author, has a new book out where he focuses on government workers, who I think are so maligned as just sort of being this lazy, malevolent force that wants to interfere in our lives. But Michael Lewis shows how most workers who work for the federal government do it out of a sense of commitment and wanting to try to make things better, as particularly in the areas that you dealt with HHS.
I believe the government workers, they're public servants, they're patriots. They want to make life better, not only for Americans, but for people around the world, both in the health area and the welfare area. They settle refugees. They do research on science. If we didn't have the vaccine center that was started during the Clinton administration, we would not have been able to solve the COVID vaccine issue decades later. So it's that original research that makes a difference. Every single one of those scientists could make more in a university. Or in a private sector research lab. But they're dedicated and they work every day. They work 24 hours a day. They work long hours wherever they are in a place like Health and Human Services. The FDA makes sure the drugs that we take are safe, and it is a signal for the world. Many countries don't have an FDA, but they take the recommendations of the Food and Drug Administration.
When you look at the FDA, the CDC, all of these agencies, there was one, the Administration for Community Living. It's got an innocuous name, but it actually plays a central role for so many older Americans in this country.
Here's what we learn about healthcare, that you have to have wraparound services. You have to worry about housing, you have to worry about nutrition, and improving the quality of life for our senior citizens means more than Social Security, which they're attacking, by the way. Try to call the Social Security office in Miami, and you'll be lucky if we can get through. And I tried the other day, and the wait was enormous. And I was trying to do it for a friend, and we never did get an answer. But for seniors, for the disabled, for the poor, we need wraparound services, and that's what community living does.
I want to shift gears for a second and talk a little bit about the attacks on universities. You're a former university president as well, working at the president of the University of Miami, before that, University of Wisconsin. When you see what's taking place now with the Trump administration going after Columbia, going after Harvard, what's your reaction to that, and why are universities so critical to a democracy?
Well, first of all, they're the place of creativity in our society, and they're the place where young people come together and meet people from different parts of the world. That's important for an education, whether it's an urban university or whether it's a public university or a private university. But but just as important, in every small town in America, there's a college. In most of the cities in this country, there's a university and colleges. These are economic drivers of our economy. If you look at the dynamic part of the American economy, it's this combination of science and technology and universities. No country on earth has the array of public and private universities, small and large, that we have in the United States. These are millions of jobs in our community, but they do have a very important job. They create Americans because we come together with students from different parts of the world, but more importantly, from different parts of the country, from different parts of a community. When I was president of Hunter College, which is another college I was president of, a big urban school in Manhattan, most of the students came from New York, but the students from Queens, from Brooklyn, from the Bronx, from Staten Island had never been to Manhattan. And they came to Manhattan for school, and many of them were new immigrants, and they got a magnificent education. It moved them into the middle class, and universities have always played that role.
The Trump administration has tried to say that the university system has become a breeding ground for anti-Semitic movements.
Universities are very reluctant to arrest their students. There's no question about it. But all of us need to deal with these issues firmly. We need to make sure that our students understand that any kind of discrimination is unacceptable, and making sure that the students understand that there will be penalties if they're unacceptable. The fact is that many of us have dealt with this, have dealt with this due process that you have to put students through. Have we done enough? You can never do enough when you're dealing with discrimination, as far as I'm concerned. But the idea that every university, every college in this country is woke, has no sense of responsibility, does not teach different points of view, is just wrong. I teach with Alex Azar, the Trump first term secretary of HHS. I teach health policy at the University of Miami with Alex. We have different points of view. We want to get to the same place. That is access to health, to high quality health care for everyone. But we come at it differently, and it's important for those students to hear the difference.
We'll be right back after the break.